Finally today, SUNUP's Curtis Hare takes us to Pittsburg County to learn about a new partnership between OSU Extension and OSU Medicine.
It's Monday here at the Pittsburg County Extension office, which means it's almost time for the free health clinic to open. Once it gets here, that is. Right on time.
Today we're here filming our OSU medical van. This is something that OSU Extension and OSU Medicine have come together and collaborated on and found a way to bridge the gap between Extension and Medicine.
Pamela Ward is the OSU Extension Director and Educator in McIntosh County. Since last fall, Pamela, along with the OSU medical team, have been holding space for Oklahoma State University's virtual care clinic every week.
So there's areas in the state of Oklahoma that are known as medical deserts.
We've kind of been expanding virtual care for the past 12 to 18 months, really. Really after COVID happened, Oklahoma State University looked at virtual care as a tool that we could use to increase access to care across rural Oklahoma.
Dr. Bradley Anderson is the medical director for virtual care at Oklahoma State University. He says when thinking about where to bring the clinic, it didn't take long to figure out where to take it.
One of the ideas was our extension office that is well trusted within a community, oftentimes concentrated on around agricultural things such as soil testing and water testing, those kind of things. We thought, why wouldn't we use that situation for healthcare?
So it's a health clinic on wheels, but what does that exactly entail? Surprisingly, a lot.
Yeah, so this is a what we kind of classify as a walk-in kind of quick clinic. Not quite an urgent care because we don't do x-rays and we don't do procedures here on the bus, but we do provide kind of quick walking visits for colds, sore throats.
Patients can even receive basic lab work for preventative care, and much like a regular doctor's visit, a nurse is there to assist.
Blood pressure's good. 110/70. So I am actually the school's nurse, so I handle a lot of student and residents, so this gets me more into like the actual community side of it. So getting to see the patients, especially out in rural areas, this is where I'm from, so it's neat to be able to help the community and be a part of something big like this.
Hello, how you doing, Mr. Jones?
Doing good.
Good.
Sometimes they don't even realize the things that they might need, and so those are some of the things that I am kind of trained on.
Vanessa Weir is a community health worker for OSU Medicine. Before patients see a doctor, they see Vanessa, and she consults with them to see if they need other resources outside of healthcare.
So maybe they come in and I pick up on, maybe they need help with hygiene items, or they need help connecting to food banks, or it might be something that they're coming in for something very simple, but I pick up on other needs, and so I can provide those resource lists.
According to a U.S. News and World Report ranking, about 61% of Oklahomans live in a medical desert, which means people often have a choice to make.
So in my county, in McIntosh County, we do not have a hospital in the entire county. So our patients have to travel at least 30 to 45 minutes to get health care.
Yeah, certainly I think transportation is one barrier, and also cost is another barrier. It's difficult for people to be able to sometimes drive. There's always an issue with people being able to afford insurance, being able to find insurance, and kind of the lack of understanding about how to get that insurance. And so I think it's a little bit of a perfect storm that occurs where there's less number of providers, it's hard to get to a provider due to transportation, and then you don't have the means to pay for the provider.
When we offer it for free, then it kind of eliminates that boundary of people being able to pay. So even if they have insurance, sometimes it might be they have to choose between a copay, or they might be choosing to pick up that medication. So even if they have insurance, they can still come see us, and that eliminates one of those barriers.
The OSU Medicine and Extension team hope to expand its regular efforts to other counties in the future. And one thing is for sure, it's needed. In Pittsburg County, I'm Curtis Hare.